Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ever heard of bacillary dysentery and wondered what it is? Well, it's more common than you might think, and it's something we should all be aware of. Bacillary dysentery, also known as shigellosis, is a bacterial infection that affects the digestive system, causing severe diarrhea and other unpleasant symptoms. It's a global health concern with millions of cases reported annually. But don't worry, it's not all doom and gloom. Knowledge is power, and understanding this condition can help us combat it. Stay tuned to understand more about this condition. So, what causes bacillary dysentery? Well, it's all down to a type of bacteria known as Shigella. These microscopic invaders are experts at exploiting our body's defenses, causing inflammation and damage to the intestine. They thrive in environments where sanitation is poor, making them a common culprit in areas with inadequate water treatment. But how does Shigella spread, you may ask? The answer is surprisingly simple. The bacteria follow the fecal-oral route. This means they are transmitted when tiny particles of feces from an infected person find their way into another person's mouth. This can happen through contaminated food or water, or even from person to person, particularly in crowded places like schools or daycare centers, where hygiene can be a challenge. In essence, bacillary dysentery is a disease that exploits our most basic vulnerabilities: our need for water, our close contact with others, and our reliance on sanitation. Now that we know what causes it, let's delve into the signs and symptoms. How would you know if you or someone else has bacillary dysentery? Well, the signs and symptoms of this condition can be quite distinct, and recognizing them early is crucial. The most common symptom is severe diarrhea, often with blood or mucus in the stool. This is due to the inflammation and ulceration of the intestine caused by the offending bacteria. Accompanying this, you may experience abdominal cramps, a symptom that is often mistaken for a simple stomach upset. Fever, nausea, and vomiting may also occur, making you feel generally unwell. In severe cases, rapid weight loss and dehydration can happen, which can be life-threatening if not addressed promptly. In children, symptoms may manifest as irritability, loss of appetite, or failure to gain weight. So, keep a keen eye on any sudden changes in behavior or eating habits. Recognizing these signs and symptoms is the first step towards diagnosis. So stay informed, stay observant, and always prioritize your health. So, how is bacillary dysentery diagnosed and treated? The diagnosis of bacillary dysentery typically involves a two-step approach. First, a thorough medical history is taken with a keen focus on recent dietary habits and travel. Then, a stool sample is collected for laboratory testing. This sample can reveal the presence of Shigella bacteria, the culprit behind bacillary dysentery, confirming the diagnosis. Once the diagnosis is confirmed, treatment can begin. This usually involves a course of antibiotics to kill the bacteria. It's important to note that the exact type of antibiotic used often depends on the specific strain of Shigella involved and its antibiotic resistance profile. Therefore, it's crucial to follow the prescribed regimen to the letter to ensure effective treatment. Beyond antibiotics, hydration is key. Bacillary dysentery can cause severe diarrhea, leading to dehydration. So drinking plenty of fluids, including oral rehydration solutions, is an essential part of the treatment process. For those with severe symptoms, hospitalization may be necessary. In such cases, intravenous fluids and antibiotics may be administered to help the patient recover. Remember, while bacillary dysentery can be serious, it's also highly treatable with timely medical intervention. So if you or a loved one are experiencing intense stomach cramps, fever, and bloody diarrhea, don't hesitate to seek medical help. While treatment is crucial, prevention is better than cure. How can we prevent bacillary dysentery? That's the million-dollar question, isn't it? The answer, thankfully, is simple and within our reach. It all boils down to practicing good personal hygiene, maintaining sanitation, and ensuring safe food and water consumption. Cleanliness, they say, is next to godliness. Keeping hands clean, especially before meals and after using the restroom, is paramount. Sanitation isn't just about personal hygiene, though. It extends to our surroundings as well. A clean environment is less likely to harbor the bacteria that cause bacillary dysentery. When it comes to food and water, it's important to ensure they're safe for consumption. Boiling water before drinking and washing fruits and vegetables thoroughly before eating can go a long way in preventing this disease. In the end, prevention is always better than cure. By following these simple steps, we can protect ourselves and our loved ones from the clutches of bacillary dysentery. Remember, knowledge is power. Stay informed, stay healthy. Let's quickly recap what we've learned. Bacillary dysentery, caused by bacteria, often enters our body through contaminated food and water. Early signs include severe diarrhea and abdominal cramps. Diagnosis typically involves stool tests, and treatment focuses on fluid replacement and antibiotics. But remember, prevention is key. Maintain good hygiene, drink clean water, and ensure your food is well cooked. Knowledge is power, and understanding this disease can help us prevent it. Until next time, stay safe and keep learning. UMCC, your ultimate medical consultant connectors.